You know that feeling when you or someone you care about has a symptom that's just worrying? That path from the first doctor's visit to getting a real solid answer can feel like a total maze. Well, today, we're going to pull back the curtain. We're going to map out the exact journey, step by step, that doctors follow when they suspect lung cancer. We'll see how they go from a simple concern all the way to certainty. So it all kicks off with that one concern, right? That symptom that finally makes you pick up the phone and book an appointment. But what actually happens next? How do doctors go from that initial maybe to a definite yes or no? Let's trace that exact path, starting from square one. Okay, so everything, and I mean everything, starts right here. Before any fancy tests or specialists get involved, it's all about you recognizing that something isn't quite right and having that first chat with your doctor. This is, without a doubt, the most important step because it's the one that kicks off everything else we're about to talk about. Now, the first thing you need to know is that this isn't guesswork. Your doctor isn't just winging it or making a gut call. They are following a very precise playbook, like the official NICE guidelines they use over in the UK. This is super important because it makes sure that everyone gets the same high level of care and that the big decisions like who needs an urgent test are based on solid evidence, not just on chance. So, what does this actually look like in the doctor's office? Well, let's break it down. According to these guidelines, if you're over 40 and you cough up blood, boom, that's an immediate referral to a specialist, no questions asked. But for other things, like a nagging cough or feeling really tired, it's more about building a case, right? If you have two or more of those symptoms, you're getting an urgent chest x-ray. And get this, even one of those symptoms, if you've ever been a smoker, yep, you're also getting that urgent x-ray. It's a whole system designed to cast a wide net and catch things as early as humanly possible. All right, so the guidelines have pointed the way, and it's time for more investigation. The very first tool doctors almost always reach for is the good old chest x-ray. This is our very first peek inside. And there's a reason the chest x-ray is the universal first step. It's fast, it's everywhere, and it gives a really good, broad overview of what's happening with the lungs and heart. It's the perfect screening tool to quickly see if anything is obviously out of place. But this brings us to a really, really critical question. If that x-ray comes back looking clean, does that mean you're in the clear? Is it case closed? Well, the answer is a big, surprising no. And this is so important. This is why the journey can't just stop there. Get ready for this statistic. For about 1 out of every 10 patients who are eventually diagnosed with lung cancer, their very first x-ray comes back looking totally normal. Just think about that for a second. That one fact right there is the reason doctors have to keep digging if your symptoms are sticking around. So, whether that first x-ray waved a big red flag or it looked clear but you're just not feeling right, the next move is always the same. It's time to get a much, much clearer picture with a CT scan. And when they say it's the investigation of choice, that is not an exaggeration. The CT scan isn't just another test on the list, it's the gold standard. Why? Because it gives a level of detail an x-ray can only dream of, letting doctors see the precise size, shape, and location of anything that might be going on. So what's really the difference? Well, think of it like this. An x-ray is like a single, flat photograph, a 2D snapshot. It's the scout you send out to get a quick look at the landscape. The CT scan, on the other hand, that's the full-blown 3D topographical map. It shows you every single layer, every hill and valley, in incredible detail. Okay, so now we have this amazing, super detailed map from the CT scan. But here's the thing. A map just shows you where something is. It can't tell you what it's actually made of. To get a real diagnosis, you have to go beyond just the picture. At this point in the journey, doctors have two big goals. Number one, they have to get a physical piece of the suspicious tissue to analyze under a microscope. And number two, they need to figure out if this thing, if it is cancer, has spread anywhere else in the body. So how do they get that tissue sample? One of the most common ways is a procedure called a bronchoscopy. A doctor carefully guides a tiny, flexible camera down into the airways of your lungs to get a direct look. From there, they can take a tiny little sample of tissue. That's a biopsy. And that's the ultimate goal here, to get that tissue under a microscope so a pathologist can look at the cells themselves. That is what gives you a 100% certain diagnosis. At the same time, they're working on that second crucial question. Has it spread? And that's where a PET scan comes into play. It's pretty cool, actually. You're given a special radioactive tracer that really active cells, like cancer cells, just gobble up. Then on the scan, these cancer cells literally light up like a Christmas tree. This tells doctors if the cancer is just in the lung or if it's popped up in other places too. And that single piece of info, it can change everything because it helps determine if a cure is still possible. So, with all of this incredible information finally gathered, we've reached the end of the diagnostic road. Now it's all about putting every single one of those puzzle pieces together to build the complete picture, and from there, figure out the best plan of attack. And that's really the key takeaway, isn't it? None of these tests happens in a vacuum. From that very first symptom to the X-ray, the CT scan, the biopsy, each step gives a vital piece of information that dictates the next move. It's a logical chain of events that builds a complete, undeniable map. And that map is the only way to create the absolute best treatment plan for each individual person. So, we've just walked through a very clear, very logical clinical pathway. It's a system designed to find answers. But it really makes you wonder, with such a structured map in place, maybe the biggest challenge of all is just encouraging someone to take that very first brave step and talk to their doctor about a simple concern.